All right, welcome, 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 everybody. Let's get this going. This is Time to Tell the Truth weekly series. It's from that old TV show, is where I came up with that to tell the truth, where people stood up, and the only one that stayed standing was the person who was telling the truth. We do a lot of research to put these together to share information because we're destroyed for the lack of knowledge. So let me tell you who I am. For those of you that may not know me, my name is Dr. Rosalind Shaw Belt. Affectionately, people call me Dr. Roz, like Oz with an R. Yeah. And I am the CEO of Dream to Life Productions and Ministry, and LLC, and even nonprofit. I'm a wife of Dr. Adrian Belt, proud wife of this man in my life. But what's important today for me to share with you is that I am a certified wellness coach. Yes, I've got a few credentials where I received certification, a certified entrepreneur and lifestyle consultant. And I am a certified wellness coach where I was under the tutorage of Dr. Eric Prince, naturopathic doctor. And that's where we received that second one, Flat Belly Lifestyle 2.0. So today's topic is what they don't teach in medical school. Did you know that there's some things they don't teach? See, sometimes we blame those doctors for stuff. And if they didn't know, and if they, I guess we can't blame them because they should do their own level of education. But doctors learn how to save lives, but not always how to improve them. See, so this isn't about blaming the doctors. That's not what I'm here to do. I'm not trying to throw all the doctors under the bus because they don't all fall in this category. But there is a definite system that's in place. And if you are a medical doctor and you're watching this, I'm going to hold you not accountable, but responsible. Responsible for educating yourself, even after you go to school for 8 years and 10 years. We got to close this gap because when you understand what your doctor wasn't taught, you that are listening to me can then take back your power. And that's what it's all about. I want you to take back your power, right?
Number one is toxicity. Okay, yeah, there's a class called toxicology, but they don't teach toxicity from the standpoint of how it's coming into our bodies and how it affects our health, the type of toxins that are the most common, okay, the household toxins, the food toxins and chemicals, the toxins that are in the air, the toxins that are in the water. They don't teach that fluoride is a toxin, so people think it's normal for it to be in water. Or that chlorine is in water, or chloramine that they're adding to water. Nobody knows that these things are actually carcinogens. Okay, nobody knows what a PFOA is. Okay, and how it's in basically all of your pots and pans, and every time you cook, you're putting that toxin into your food, and it's known to be a carcinogen that causes cancer. They don't teach you that 70% of the standard American diet is highly processed foods that are filled with toxins. Okay, and what impact does that have on your health? What accumulation? How does that accumulate in the body? Because most of the times when they're studying the toxins, they're studying them individually. But when you look at a label for one food product, there's at least 50 chemicals in a lot of the food products, just one that people are consuming, and people are consuming multiples every day. Not to mention, that's just food. We're not talking about what you wash your clothes with. We're not talking about the things that you clean your house with. We're not talking about what's in the water, what's in the air. So we never consider what is the accumulative effect on a biology level or biochemistry levels of all of these toxins accumulating in our bodies. Do they leave? Yeah, we may look at a toxin or a heavy metal individually and see what happens, on an individual level, but we're talking about thousands, tens of thousands of chemicals that we're putting in our bodies on a daily basis for decades that is accumulating in the tissues on a cellular level. They don't teach us about that. So as a result, when you go into the doctor you may have heavy metal toxicity, and you may have worked at a heavy metal plant. You may have worked at a concrete plant where there's a lot of heavy metals in there. Okay. They never consider that. Rarely is that ever considered. Or that if you're pescatarian and the heavy metals that you're getting, all that mercury that you're getting from all of the fish, because you don't know that certain type of fish accumulate heavy levels of mercury. So then you thinking to yourself, well, I'm pescatarian, I'm primarily mostly plants with a little bit of fish here. But you go into the doctor, you're having cognitive issues, we're having nervous system issues, you're having gut issues. And you never attribute that to the fact that they're heavy metal. And the reason why the doctor never attributes that to your health issue is because we're not taught that. We're not taught to look for these type of things, especially in the society that we live in today. If we were to go back and look at our grandparents, our great-grandparents' diets in the 1950s and before, and you compare the food, okay? Compare the same meal you would have ate today versus the same meal they would have ate 50 years ago. But most of your things are in box, bag, cans, and jars, and there's a lot of toxicity and food chemicals and dyes and emulsifiers and thickening agents that you have no idea, because they used to get their things straight from a farmer's market or the farmer, and it used to be fresh. Because if you go back to the 1940s and 30s, most people didn't even have a refrigerator. Okay, it's a relatively new invention around that time. So if we go back and look at our great-grandparents and their diet, it was mostly plants. It was mostly organic, okay? Because the new agri-system of spraying everything with toxins, pesticides, herbicides, and insecticides wasn't heavily in place then, okay? So it's hugely important, and understand that you have to be the gatekeeper of your toxicity that you put in and on your body and in your environment. Because we are not taught this. Even as a pharmacist, they did not teach us about this. Okay? Even as a pharmacist. So toxicity, not taught about that. Again, yes, I took a toxicology class. Did it teach me anything about the toxicity that is in food? How to watch out for the toxicity that is in the water, etc.? No, it did not.
No, it did not. Absolutely. Somebody put it in the chat. I am the gatekeeper. See, we got to be the gatekeeper over our lives, over our families' lives, over the people that we care about. And that's what I hope this will give us some enlightenment, because there are things that have limited talk about in medical school, or some things that are not taught at all. Nutrition is one of them. Now, he just said he's going through a few of them that we're going to look at today. Toxicity was one. Do you know nutrition is another? Most medical schools offer minimal education on nutrition, exercise, or how lifestyle factors prevent or reverse chronic diseases. I mean, some of these things can totally be reversed if we were taught certain things. And listen, many doctors graduate without learning how to even effectively counsel patients on diet, stress, sleep, or environmental toxins. I've seen this firsthand. I never shall forget when my husband, we went to the doctor for him to go get a general checkup. And the first thing that happened, we had to sit there too long because the appointment was at one time, and it was like 45 minutes to an hour before he ever saw the doctor, and he needed to get back to work. So when he got in there, his blood pressure was up. Well, it was up because y'all made him wait so long, and he was getting phone calls from his job. But then the doctor, when he came out, had given him a prescription for high blood pressure medicine. And so I asked him, did she ask you what you've been eating? Did she ask you, do you exercise? This was first time meeting this doctor, and she didn't ask a single one of their questions. So the thing is that they're getting less than 25 hours of nutrition in medical school. That's a statistic. You can look that up. And so sometimes patients with diabetes, don't receive but a little bit of diet counseling. Matter of fact, we did a session once, one of our sessions, we talked about the kind of food they feed you in the hospital. Okay?
If you're a foodie, then you might be better at nutrition than your doctors. For real. So why do medical schools teach so little about nutrition? Well, it turns out the focus is heavily on disease treatment, not prevention. Think about it. How often do you hear about doctors prescribing apples instead of pills? Medical students cram in endless hours on anatomy, pharmacology, and pathology. Nutrition? Not so much. On average, they get less than 20 hours of nutrition education in their entire training. But here's the kicker. Poor diet is a major factor in many chronic diseases. Heart disease, diabetes, obesity, you name it. So why the gap? It's partly because the curriculum is ancient and partly due to a lack of nutrition experts on faculty. So next time you visit your doc, remember, they might be experts in many things, but nutrition might not be one of them. And that's your food for thought.
And that's something to really, really think about when we can get so much from nutrition. So I even looked it up. When I see on many different websites, here's Stanford Medicine, School of Medicine. They had an article called Why Medical Schools Need to Focus More on Nutrition. The US News in the health section says, how much do doctors learn about nutrition? The answer, it may not be enough, but it's not their fault. So again, I want to reiterate, because I may have a doctor that watches this, or you may be present right now. I'm not trying to throw you under the bus. But what I'm saying is we've got to do our own due diligence.
Number two, the number two thing we're not taught as healthcare professionals in school, nutrition. I know this sounds crazy to you because I hear people say this all the time. They went into their doctor, they had gallbladder surgery or gallbladder stones, they had digestive issues, they had irritable bowel syndrome, they had colon cancer, you name it. All of these things that are directly connected to the digestive system. And then they say, well, what do I need to change in my diet? When the doctor gives them a prescription, and the doctor says, oh, there's nothing in your diet you need to walk. I literally have heard a doctor tell a patient with colon cancer, this has nothing to do with your diet. And your colon is literally being eaten away by cancer. And the only thing that touches your colon is what goes into this pie hole. And you don't think anything has to do with what you're eating? You gotta be a damn fool to think that could be true. Okay? But the reason why they say that is not because they're malicious. It's not because they're evil scientists or they hate you or they're trying to make money. It's not because of that. And I'll explain why in just a second. The reason is we're not taught nutrition at all. So when you ask your doctor a question about nutrition, it's literally like asking your homeboy. You're asking a layman. They know we are not required to take nutrition. Now I took it because one of my science degrees was exercise physiology. Okay. So I had to take the nutrition course, but other than that, I didn't have to take anything. All right, so we are not required to take nutrition courses, which means that we can't guide you in the foundation of health, which is what you eat. Listen, only 5% of diseases are caused by genetic or congenital effects, okay? Congenital diseases. Only 5% of diseases, and they are the most rare diseases. They're not the things you think. They're not diabetes. They're not heart disease. They're not thyroid issues. They're not, things that are related to autoimmune conditions. None of those things. The things that when you look around in your family and you see these things are running in your family, consistent diabetes, high blood pressure, strokes, things of that nature. It is not, those are not in those 95% of diseases aren't genetic. 95% of diseases are lifestyle. And lifestyle is primarily what you eat with a whole host of other things like sunlight, water, movement, etc. Okay, and so we don't learn the foundation of health and healing, which is what you're eating, what you're putting in your pie hole. Okay, so it makes sense why we're so sick. Okay, so I want you to think about this for a second, and this will help you know that what I'm saying is true. When you go into a hospital, you ever visited someone in the hospital or been in the hospital yourself? I had to stay there as an inpatient and look at the food that they give people who are in the damn hospital. It is processed junk food, things that are in plastic wrappers, a little bit of ice cream, a scoop of this, some highly processed meat, some highly processed mashed potatoes, some genetically modified corn. Okay, now that's what they're feeding people who are actually sick and in the hospital. Okay, but here's why I really want you to take a look at for a second, and then you'll really know that they do not teach us nutrition. Otherwise, we're just being intentionally ignorant. Look at the cafeteria, okay, where most of us as healthcare professionals go to eat on our break. Look at the food they're serving there. Highly processed, unhealthy food in most hospitals. Look at the restaurants that are in hospitals. Most restaurants I see in hospitals are like Taco Bell and McDonald's. I literally worked at a hospital that had a McDonald's on. And guess what? You would see healthcare professionals, doctors, pharmacists, and nurses in line on their break at McDonald's getting food. That has to tell you, we know nothing about nutrition. We were not required to take it. We know nothing about it. Everything that most doctors tell you about nutrition is layman's advice. It's stuff they're goofy. Okay, it's stuff that they think is true. Okay, and that is very dangerous. Okay, and take a look at most healthcare professionals. Most healthcare professionals, although they pour their heart out to their patients, spending 14 and 16 hours at the hospital, most healthcare professionals are unhealthy too. They're on just as many medications as you are. They're just as overweight as you are. I remember being at a potluck at work, and one of the doctors brought in a 7-cheese macaroni. And when you went to take the spoon to run the spoon through it to stir it up, I mean, it sounded like mayo. It was so thick going through it. And I was like, man, that's going to give you a heart attack. And he was like, don't worry about it. I'll just take another one of my Lipitor, which is for cholesterol. So it tells you we know absolutely nothing about nutrition. They do not require us to learn it. And that is a foundation of health and healing.
Wow. Wow. You know, it's amazing when we really get this. And so much of it, it just makes sense. And so the question came to me as I was really dissecting this is why? Why don't they teach them more about nutrition? And as I began to dissect into this, one of the reasons is because the medical curriculum is already overloaded. Medical school is packed. I mean, they go to school many, many, many years, and it's packed with anatomy, pharmacology, pathology, and clinical rotations. And so at some point, the faculty often argues that there's no room for any more courses. So guess what gets squeezed out? Nutrition. One of the second reasons why there's a lack of teaching of nutrition, or it's very limited, is that pharmaceutical and disease is the centered focus. The focus is on drugs. The dominant model of healthcare is diagnose, prescribe. I just told you the example. When my husband, blood pressure up, prescribe. There's more emphasis on managing disease than preventing it with food, lifestyle, or environment. One of the other reasons why there's a lack of nutrition being taught is that there's a lack of faculty with nutrition expertise. Many of the professors, they're not trained in nutrition themselves, so guess what? It's not prioritized. And schools rarely hire dedicated faculty just to teach functional or integrative nutrition. Another reason is industry influence, the pharmaceutical companies. Oh, we know this, right? Pharmaceutical companies often they got deep ties into the medical schools through funding and research. So they got money in there. And so they're not going to go against the grain because they need those grants, they need those monies, and there's more money in pills than in produce. So nutrition does not get center stage. I need you to get this. I need you to not be destroyed for the lack of knowledge. Number 5 is outdated standards in accreditation. See, nutrition, it's not required, like Dr. Price said, it's not a required core competency by a lot of the accrediting bodies. That's not required on the curriculum. And until it becomes a board exam relevant topic, it's not going to get the attention that it should. And then number 6, the assumption that doctors can refer out. If they want to talk about nutrition, they'll refer to somebody else. And that's an outdated belief that doctors can just refer patients to a dietitian. But many patients never, ever see a nutritionist or look to the doctor for guidance first because that's who they believe in because the doctor said it, right?
Number 3, the microbiome. Okay, that's the good bacteria in your gut. But here's the other thing. You have a microbiome in your gut. You have a microbiome on your skin. You have a microbiome in your nostril. Women have a microbiome in their vaginal canal. You also have a microbiome inside of your mouth as well too. And here's just a few functions of your microbiome, that good bacteria garden in all the places that I just named. Helps you to digest and break down food. Okay, that sounds pretty important because you can eat all the healthy food you want, but if you can't break it down, you can't get the nutrients out. And it turns into waste in your body and can't be transported out of the body because it's not properly broken down. And now it turns into a toxin. Okay, so it helps to digest food. 70 to 80% of your immune system comes from where? Your microbiome. So if you're a sickly person, you probably have an unhealthy microbiome. Number 3, it helps with mental health. It is key and instrumental for both serotonin and dopamine. We know dopamine gives us that I accomplished something, that feel good feeling that we get when you get like 1,000 likes on Instagram or on YouTube, 1,000 views or whatever it is, and you feel good because you feel recognized. Guess what? That's dopamine. And guess what? The microbiome, it helps to produce dopamine and also serotonin. And that's 90% of serotonin. And serotonin is known as the happy molecule. Okay? Because it keeps us happy. So as it drops down, guess what? We get less and less happier. Okay? So an unhealthy gut leads to mental health issues like depression, anxiety, etc. All right. It's also good for the skin as well too. So you got skin issues. As I told you, we got a microbiome here. We got the microbiome, even in our gut, is intimately connected with our skin as well too. But the microbiome on our skin helps to protect us, okay, from fungus and bacteria. But it also converts the oils that are coming out of our skin into like a natural moisturizer. This is why when you eat healthy, you have a healthy microbiome, your skin looks glow. And the tone is great as well too. All right. Also, the microbiome produces its own antibiotics, meaning it can produce antibiotics, those ones that you get, from the synthetic kind, the prescriptions. The microbiome is capable of producing its own antibiotics to fight off to fight off bacteria. But it also can produce things to fight off viruses as well too. Okay, and I'll tell you this, the prescription antibiotics kill your microbiome. Put that in perspective for a second. They absolutely kill and murder your microbiome, all right? And then also, it helps to maintain blood pressure as well too. This is why unhealthy gut can lead to high blood pressure as well too. And that definitely was part of my problem as well too, because I definitely had an unhealthy gut. All right, so that's number 3, the microbiome.
Number 3, the microbiome. So we've covered 3 so far, and so many other things that we're dealing with. Here's one that also is a very much problem why we don't, why something is not taught in medical school: communication and empathy. How many of you ever been to the doctor and they didn't communicate well with you, or you're telling them what's going on with you and there's no empathy? Now, they got the knowledge. The clinical knowledge is what's emphasized, but bedside manner, I've seen some doctors with some poor bedside manner. How they listen. You know, you got some doctors, and again, we're not throwing them all under the bus, but we've got to educate ourselves, and some of them are just looking at their watch to see how quickly they can get to the next person. Or even how to deliver bad news. I'm sure it's difficult. I can't imagine. Even when I watch doctor shows, you can see how difficult it is to give bad news. My husband had a son to die, and he knew when the doctor walked out. But they got to know how to deliver that bad news with some compassion. But that's not sometimes taught, or it's under taught. And even emotional intelligence, patient rapport. Some of you like your doctor. That's a wonderful thing that you like your doctor. But as a licensed insurance agent, I often have clients of mine that are on Medicare, and they're telling me how they don't like their doctor, so they don't care about switching doctors. Cultural sensitivity, and sometimes that's learned on the job, but it needs to be taught. And then the lack of training in delivering that bad news, handling patients' fears. You know, sometimes you're there and you're afraid. You're afraid about you're afraid you're fixing to go into this surgery. So this is real life stuff that actually should be taught in medical school on a large scale, not just one maybe little course, because sometimes that's more important than the surgery itself, because your mindset when you're being rolled into that surgery room has a whole lot to do with how well you come out. So you want to be trusting. You don't want to miscommunicate.
Number 4, botany, which is the study of plants, and plant medicine. They don't teach us that. All right, this is why when somebody does my detox, all right, I always tell them, hey, take it into your doctor. You see the back, you can see the ingredients, etc. I always say that. But here's the thing. They don't teach us that. So this is why a lot of healthcare professionals, when they find out that patients are taking any kind of natural remedies, they shy away from it, because the industry that did teach us, the pharmaceutical industry, has programmed us to believe that anything natural is bad and everything synthetic is good. So when you're using drugs, don't use the plants, because the plant will affect the drug. Okay, so it's hugely important to know and understand. This started in the early 1900s with Rockefeller. Rockefeller created this whole new idea of taking over the medical industry. And he started by creating a report. And the report was called the Flexner Report. He had this guy, last name Flexner, go all through the United States, visiting all the medical schools. He did a report telling what medical schools are good, what medical schools are bad. There was only one that he came back pretty much and said was decent, and that was Johns Hopkins. Every other one, he's pretty much wrote a bad report on. And after this report, he started what is called the GED, or the General Education Board, and started flooding money into it and told schools the only way you can get this money, millions of dollars, the only way you can get this money is if you go by these new standards. And one of those new standards was the only approved therapy is a pharmaceutical drug. It has to be patented. And guess what? You can't patent nature. The reason why you can't patent nature is because it's nature. All right? You can patent anything that is synthetic, and that's what drugs are. All right? So it essentially created a war on drugs. All right? And all of the schools that essentially said, okay, I'll follow what you want us to do, That's what they started doing. Only using drugs, only using, surgeries, only using patented therapies. And they essentially outlawed anything that was natural. That included not only plant medicine, but things like chiropractic work, things like energy work. All of these natural modalities that have been people primarily used up until that time. So the schools essentially said, okay, well, to get your money, we'll go. And guess what? Schools are still doing the same thing today. No different. No different. All right. So this is why most healthcare professionals never learn anything about nature, botany, the study of plants, or plant medicine. And this is why most of them are against plant medicine, because we've been taught that. Even when we're taught about certain herbs, we're taught about the interactions that these herbs have with drugs. We're not taught about the therapeutic benefits to the actual patient. And we don't realize that in some cases, the actual herb needs to be in place and no medication. All right, so it's really important to understand. Until you understand nature, you'll never understand biology. Biology is the study of life. Plants were here long before we were. So we come from plants, we're of plants, we're of nature. So until you understand plants and nature, you'll never understand biology, which is why we'll never understand healing if you continue in the direction that they're going in. All right, hugely important.
Hugely important. Love it, love it, love it. I mean, it just makes so much sense because yeah, it's going to have an interaction with your medication. Absolutely, because it's going to lower the blood pressure and the drug is going to lower the blood pressure. So one of them got to go. One of them got to go. And that's why we have to make intentional decisions ourselves. You've got to make a decision for your own self, but we've got to implant into your psyche this teaching, this understanding, because we haven't been taught. Another thing they don't really teach in medical school is about business, about billing, and about insurance. So many doctors aren't taught how to read or negotiate a contract, how to run a private practice, how to navigate insurance codes or billing systems, how to understand how hospital politics and administration work. It should be taught in medical school, not that you have to go take another course. Why shouldn't you be taught that? Especially if you're going to go into your own practice. So that means a lot of medical students often leave school financially literate, only in debt. Doctors graduate without knowing how to run a business correctly. And the hidden side of medicine, those codes, those billing codes, and the insurance disputes, and the administrative burnout. So there's so many other things other than just being taught pharmaceutical drugs that need to have a higher standard of teaching. Maybe they teach a little piece of it, like we said about the nutrition, less than 25 hours, but there needs to be more of it.
Number 5, connection, not reduction. Here's what I mean by that. We're taught to look at the human body and disease from a reductionist standpoint. What that means is that I compartmentalize whatever is going on. So if you have diabetes, it means that you have elevated blood sugar. I'm only going to look at your blood sugar, which means that I'm only looking in the blood, which means that I don't look at what is causing the actual blood sugar to be elevated or spiked. That's a reductionist model that healthcare professionals live by and think by. It is the most absolute. Let me be respectful. It is one of the most unintelligent ways to think about something. Because what it doesn't do is consider the whole picture. It doesn't consider the whole patient. It doesn't consider the lifestyle. It only looks at the blood and the blood sugar, which means that they make a drug that does something to your blood sugar. But that is the symptom, not the cause. If you address the symptom and never address the cause, guess what? You're going to be a lifelong patient. That's all that means. You're going to be a lifelong patient. That means this is why there's no drug for a chronic illness that you start and then it heals you. Name one. Not even over the counter. We don't even have a cure for the common cold. Okay? Let alone high blood pressure, let alone diabetes, let alone strokes. People don't even know, like, if you ask your doctor what's causing the clots, like, let's start there. But we can't start there because we don't have the foundation. All right. So we're constantly looking at you from an individual standpoint. So when you got a problem with your gallbladder, instead of addressing the cause, they just remove your gallbladder. Gallbladder surgery or gallbladder removal surgery is the #1 elective surgery in America. They do somewhere between 500 and 700,000 surgeries to remove gallbladders every year. All right. And all of a sudden you feel better because you're not throwing up or you're not having, fatty stools, etc. But what they don't tell you is all of the symptoms that come with having your gallbladder removed, which I think is hugely important. Hugely important. You're gonna have issues digesting fat. You're gonna have very bad diarrhea, gas and bloating. You're gonna have stomach pain. You're gonna have right shoulder pain. Okay, that's one of the signs and symptoms. You're gonna have yellow eyes and yellow skin sometimes because of that bowel accumulation. Your liver, which is still going to be producing bile, but it's going to be dropping it directly into your small intestines. That leads to issues. They don't talk about that. Okay, dryness in your eyes and vision issues. This is all just from gallbladder removal surgery. Okay, and it increases your risk for type 2 diabetes. So I literally hear this and see this all the time. People who had the gallbladder removed, now they have type 2 diabetes. Now they got vision issues. Now they're having a whole ton of digestive issues that they were having in the first place, but they addressed the symptom by removing the gallbladder, which is something that you need because it concentrates the bile in you to go into the small intestine. Okay. So hugely important. They do not teach us the connection of the body. I'm gonna tell you something that's gonna sound a little bit radical, but there is no heart, there is no gallbladder, there is no kidneys, there is no lungs. Everything works in unison like a symphony. So when you got an issue in your lungs, trust me, you got issues other places because everything is intimately connected. As a matter of fact, if one cell started to become cancerous, every other cell in the body is alerted. We have 75 trillion cells in our body. So as soon as one cell becomes cancerous, the reason why you don't develop cancer is because neighboring cells see it happening, feel it happening, and communicate to virtually every cell in the body. And so when you get that disconnection with your body, the same disconnection that happens with the thinking around healing in the modern medicine system, now it doesn't alert those other cells. So that cancer is free to grow and roam and progress without notice. Okay? But this is a huge issue. It's a huge issue in modern medicine, not understanding that everything is intimately connected. There is no, trust me when I say this, everything is one in our body. I know it doesn't look that way, but you literally could have a toe issue that affect your liver, okay? You can have a spinal issue that affect one of your organs. Okay, it's hugely important to understand that everything is intimately connected. So number 5 is something that they just don't teach us.
So the neck bone's connected to the shoulder bone, and the shoulder bone's connected. Remember that song back in the day? Yeah, everything's connected. Okay. So another thing they don't teach in medical school: holistic and alternative medicine. There's minimal focus on holistic, integrative, or functional medicine models, despite many patients use them. Topics like, and he mentioned them, energy medicine, Let me tell you something. The power in being in a room full of energy is amazing. Herbalism. We should know about herbs. Our great great grandparents knew about herbs, and they might not have known the term and the terminology, but they knew how to go to the backyard and pull up something and they would put it on you. And there's still certain cultures that live by those teachings in other countries, not here in the United States, unless you've learned it for yourself. Detoxification, we talk about it all the time, how we should live our lives detoxing ever so often. Or what about emotional root causes of illness? Do you know I have ministered to people that are sick in their bodies, and the Spirit of the Lord has ministered to me to let me know that they're not sick. They have an emotional, they may have unforgiveness. Unforgiveness can be so deep rooted into your body that all of a sudden you're sick all over. You've got certain things going on with you chronically just because you won't forgive your sister from 30 years ago. That's not taught to address those kinds of things. Rarely taught, despite even the rising patient demand. It's not taught what patients want versus what doctors are trained to provide. I've had people tell me that they go to the doctor and they can tell them what's going on in their body, and the doctor's not listening. That particular doctor is not listening to what the patient is saying. How many people have you known that said, you told the doctor something's wrong with me? And he looks at his chart, he looks at all the things you've done and says, we don't see anything. And it just must be in your mind. But that patient knows from their own body there's something wrong. And then later on, they find out. And then here's something that just really caught my attention: doctor self-care and burnout. Medical school trains doctors to care for others, but rarely teaches them how to protect their own mental health. A lot of new physicians, they aren't even prepared for the toll of the long hours, the patient deaths, or compassion fatigue. We got a taste of that during COVID. And we started seeing how doctors were experiencing. We're just thinking about the people who died from COVID, but we're not thinking about the self-care and the burnout. 60% of doctors report symptoms themselves of burnout. So there's no formal training on how they have to manage that stress, that work-life balance, or their mental health.
Physician burnout, finding balance between work and life. When patients go to the doctor, such as the ER or to their primary care physician, most do not think about what that particular doctor may be going through. A recent Medscape survey of over 15,000 physicians and 29 specialties found that an astonishing 42% of physicians report burnout, 12% feel down, and 3% are clinically depressed. So what is physician burnout? Well, I'm glad you asked. Burnout is a long-term stress reaction characterized by depersonalization, including cynical or negative attitudes toward patients, emotional exhaustion, and a feeling of decreased personal achievement and lack of empathy for patients. And it doesn't happen overnight. It develops incrementally due to chronic decreases of stress and efficiency and excessive workload. According to Medscape, ICU doctors, neurologists, family medicine doctors have the highest amount of physician burnout, with plastic surgery having the lowest. In terms of gender, a higher percentage of females reported burnout. The causes of burnout vary, but include insurance issues, threat of malpractice, income not high enough, too many hours, and decreased reimbursements. So how do physicians cope with burnout? Almost half, 46%, say they exercise, while others report talking with family members or friends and sleeping. When it comes to seeking professional help, psychiatrists are the most likely specialty to seek out professional help for depression, burnout, or both, with cardiologists having the fewest seeking help. In terms of physicians who are the happiest, ophthalmologists, orthopedic surgeons, and plastic surgeons top the list, with critical care physicians and cardiologists being at the bottom. So what about physicians that report that they are experiencing burnout? What are they doing that is allowing them to avert burnout? Well, these physicians are asked to write about how they deal with work-related stress. The most common answers were exercise, maintaining a sense of accomplishment, and a supportive group of colleagues, family, or both, and balance between home life and work life. Thank you for watching. Please subscribe. Until next time.
So now, when's the last time you thought about what the physician was going through? Was it, I mean, they're people, right? They're people just like everybody else has got family problems and all kind of situations, and yet they still got to go to work. It's a job. It may be a calling, but they still have to go to that job. And when I think about COVID, I used to see things on television and the news of the people that were dealing with. When you're seeing that much death, when you're seeing that many people on ventilators, you need to prepare me for that. You need to work with me and prepare me for those kinds of things that could happen while I'm in medical school. I remember being in high school and we were getting ready to go to a place called Richmond State, and it was a place for those that were having mental problems in their body and in their lives, and they were mentally challenged. And when we walked there, they had told us ahead of time to be prepared for it. But still, when you walked in the door and you saw a person standing up against the wall, just beating their head up against the wall, you weren't ready for that.
Chevron incision on the top, fanny steel on the bottom.
Well, is the one on the right a lance?
Yes. Are we done now?
This one. Just for fun.
Respectfully, Dr. Weber, I don't have time for this.
Catherine and I visited several museums on our trip, and we saw thousands of paintings and sculptures, and classics and modern works. And thinking of the techniques and the choice of colors was, that was restorative for me and necessary.
Could you just say the thing I need to hear?
You need to take a break, Schmidt. You leave the hospital, take a walk, because if you continue to scream at nurses, your chief resident job will be short-lived.
If I take a break, things won't get done and patients will die. And if I lose someone that I could have saved, again, I don't think that I could come back from that. I need to go back to work.
I've arranged a phone call for us with a major consultant to help us with a more formalized plan. Where are you going?
On vacation. Well, I haven't just taken a vacation day ever in my life. I have a new little girl at home. 2 teenage boys who haven't seen both me and Ben in the same room in months. They need me.
This hospital needs you.
Yeah. This hospital needs too much of me. Now I'm done being the superhero. Meredith Grey can go away, and so can I, Miranda. Catherine, I respect the hell out of you. You know I do. I know you understand what it's like to be a woman at the top of her field who isn't allowed to rest. So I need you to hear me when I say I'm not quitting. I'm not taking a leave saying that I can't handle this job, but I am taking a vacation day, maybe 2. I'm no good to you like this.
Put simply, burnout comes from a deep imbalance. Too much stress with too few rewards. You're exhausted, depleted.
See, so everybody needs to, take a day sometimes in your life. So that needs to be taught in medical school. Another thing that needs to be taught, or is rarely taught, is the root cause versus the symptom management. Dr. Price talked about that. The root cause versus symptom management. See, there's an emphasis on diagnosing and treating with medication, not always on why the illness occurred. The chronic conditions like diabetes, hypertension, autoimmune disease, they're often managed, not reversed. Do you know they can be reversed? Has anybody told you that they can be reversed? You don't have to live with them. They don't have to be a part of you. So we focus on meds instead of the root causes. And one of the examples is lifestyle changes, reversing hypertension, or type 2 diabetes.
Number six, the lymphatic system. We scapegoat it, we skim over it, and they tell us a little bit about it, but we don't know anything about it. And the reason why I know we don't know anything about it is because most people's lymphatic system is stagnant. Most people's lymphatic system is overburdened with toxins, and that is causing a lot of the issues around people's health. Okay? Most people don't know that your lymphatic system is your waste system. It gets rid of not only waste, but it gets rid of excess fluid. It also gets rid of bacteria and viruses that have been inoculated. Okay? It also gets rid of cancer that has been killed as well, cancerous cells that have been killed as well too. So essentially, when your lymphatic system becomes blocked and stagnant, now all this backs up back into the body, that waste accumulates. Those bacteria, those viruses are able to sort of revitalize themselves. You have to know that a virus isn't dead or alive. So even when you kill it, it's not dead. It's inoculated, it's neutralized. So if you don't get rid of it out of the body, it becomes a problem. Same thing with cancer cells. Same thing with waste in the body. All right. So it's hugely important. We don't understand the lymphatic system. As a matter of fact, they just discovered that there's a lymphatic system in the brain. Now, the reason why that's crazy is because the brain is supposed to have a blood-brain barrier where nothing gets across, no toxins, no waste. And now we discovered that we have a lymphatic system called the lymphatic system in our brains that is removing waste, that is removing toxicity. Yeah. So we don't learn it. And because we don't learn it, we don't understand how when somebody gets Alzheimer's or dementia or other conditions of the brain, heavy metals, things of that nature, we don't understand the importance of our lymphatic system, so we never look at it. We never think that that's a problem.
So much of this, and as I was getting deeper and deeper into this, I realized that I couldn't do all this in one part. So there's going to be a part 2 of this. We're going to stop right here. So what I challenge every one of you to do is to move towards detoxing your body. Move towards educating yourself over and above what your doctor may or may not know, or even question them and ask them, how much do you know about nutrition? Put it back on them so that they can have the responsibility to educate themselves. As I used to hear one of our doctors say, do their due diligence. And as we do our own due diligence, we take our power back. So join us next week as we get into this part 2 of this. That we're just scrape the surface right now. So we'll do part 2 of this on next week. Thank you guys for being here. Fantastic. Love it, love it, love it.